Okay, good evening, everyone. Thank you for this privilege to present this topic, viral hepatitis in Nigeria. I specifically chose this topic because I realize viral hepatitis is a condition that is quite common amongst people. However, many people are living with it without knowing they have it. So that's why I chose the topic. So within these few minutes that I have with you, I'll be discussing a little concerning viral hepatitis in Nigeria. I'll be using this headline. We'll talk about the introduction, the epidemiology, and then prevention. Very important. I'll be focusing more on the prevention. Okay, so as an introduction, viral hepatitis is hepatitis generally means an inflammation of the liver. Okay, so in this condition, the liver is inflamed. Inflammation simply means, in layman's term, swelling. Okay, for example, if you bump your hand on the wall and then it swells, in the medical world, we refer to that as inflammation. But in a layman's term, you can regard to that as swelling. Okay, so there are several types of virus that are implicated in the cause of hepatitis. So we have hepatitis. Hello, are you with me? Okay, so we have hepatitis A, we have hepatitis B, C, D, hepatitis E, as well as a non-common hepatitis G. Okay, so hepatitis A and hepatitis E are caused by ingestion of contaminated food or water. Okay, so they are transferred via what we call fecal-oral transmission. Okay, so hepatitis A and hepatitis E are viral hepatitis infection that occur when there is poor hygiene. So it is very, very important to note that hepatitis A and E, while they are not quite a major cause of morbidity and mortality that is associated with hepatitis, they are quite related to sanitary condition where hygiene is poor. People defecate close to their living quarters. The feces get into their food or into their water source, and then they ingest it, and within a short period of time, they can come down with hepatitis A or hepatitis E infection. Okay, so grouping these two together, that's hepatitis A and hepatitis E together, because their mode of transmission is the same and their virulence is also basically the same, and their mode of presentation is also similar. Okay, so viral hepatitis A and E usually cause acute infections. Okay, they are not infection that get to be chronic. Acute infection means that the effect of infection with hepatitis A or hepatitis E is usually seen within a short period of time, and after a while, it weans off. Okay, even without taking any drug, even without doing anything extra, the body's immune system can easily clear them off. In very rare cases, it can lead to fatal condition. And then I'll be focusing more on hepatitis B and hepatitis C. And then I'll talk a little about hepatitis D. Hepatitis B and C are the most common form of hepatitis worldwide, and they affect a whole number of people. As we move on, I will tell you more on the epidemiology. Hepatitis B and hepatitis C are chronic causes of viral hepatitis. Okay, they affect the liver after in the long term. Okay, their effects is not usually seen immediately, but within a long period of time, they continue to cause damage to the liver. And if nothing is being done, it can lead to serious complications. Okay, these complications could be uh, uh, liver cirrhosis or what we call liver failure, and then they can also lead to liver cancer, the dreaded liver cancer that we all know about. Okay, so I'll be going to the epidemiology straight up. Okay, according to the WHO, about 250 to 300 million persons are chronically infected with hepatitis B. So hepatitis B is actually the major cause of morbidity and mortality, especially within Africa, especially within Nigeria as a country, because our focus is on Nigeria. About 150 million persons worldwide are chronically infected with Hep C. Hep C is also um, having a large burden on the world, but we can see the figures the figure for hepatitis C is a bit lower than that for hepatitis B. So hepatitis B is the major cause of morbidity and mortality related to viral hepatitis worldwide, while hepatitis C is next in line. Okay, so I will talk a little about hepatitis D here now. So hepatitis D is also a cause of viral hepatitis that does not cause destruction of the liver on its own. Hepatitis D is usually attached to hepatitis B. So only persons that have hepatitis B infection can have a super infection with hepatitis D. And when that occurs, the level of liver damage tends to be accelerated. It tends to worsen the damage to the liver. Okay, on its own, viral hepatitis D cannot cause infection, it cannot cause disease. Okay, but when a person is infected with hepatitis B, viral hepatitis D can now have, like a passage to get into the body, and then it causes destruction to the liver. Okay, um, there are about 20 million Nigerians. Okay, so this figure is a rough estimate that is given. As we know, Nigerians were not so good in keeping data, but from what I could find online, and then also from the WHO, about 15 to 20 million Nigerians, okay, are infected with either hepatitis B or hepatitis C. Okay, and then some have both. Okay, so the mode of transmission of this virus is usually via contact with infected blood and blood product, as well as body fluid. Okay, the major route of transmission is through contact with uh, blood products. Okay, so when people are having blood transfusion and then the blood is not properly screened, um, the blood is already is taken from someone who is infected with hepatitis B. Before you know it, and then it's now given to the recipient of the blood. Before you know it, within a short period of time, the person begins to develop symptoms of hepatitis. That is if the person becomes a chronic carrier. Okay, so over 1 million persons die every year from hepatitis worldwide. Okay, 1 million people lose their lives due to chronic viral hepatitis worldwide. In Nigeria, that figure is about between 8 to 10,000. Okay, about 10,000 people, 10,000 Nigerians lose their life due to complications of hepatitis every year. So you see, that's why it's an important topic for us to discuss here. Okay, so going into the clinical features now. Before I talk about the clinical features, I would just want to say some things about the virus. Viral hepatitis is uh, something that affects the liver. Okay, so a little about the liver. The liver, for some of us that have forgotten our biology, we will know that the liver is one organ in the body that is very, very important for metabolism. It's the center of metabolism in the body. A lot of protein metabolism, fat metabolism, and even carbohydrate metabolism takes place in the liver. So viral infection with the hepatitis virus affects the liver to stop the liver from carrying out this effective function of metabolism. So that is why it is very, very important for us to know how to keep our liver safe from this virus that can cause a dysregulation of the normal function of the liver. So talking about the clinical features that we can have in viral hepatitis, patients that have viral hepatitis can experience no symptom. Some of them, most people don't even have symptoms. So that is why most times viral hepatitis go unnoticed. So people that have the infection, it is being said that out of this large figure that I gave earlier about the number of infections, of which I told you, if you remember earlier, I told you about 250 million people are infected with hepatitis B. Out of that 250 million people that are infected worldwide, only about 5% are aware of their status. Most people don't know their hepatitis status because viral hepatitis can present with no symptom. Okay, so you will just be a carrier of the virus and not necessarily having any symptom. So, but the good thing about this infection is that when the infection happens in adult, that is when a person acquires the infection, or when someone gets infected with hepatitis B or hepatitis C, as an adult, the body's immune system can actually fight off the disease, and the person within a period less than 6 months can become negative. Okay, so I hope I'm not confusing you. Most people that get infected with viral hepatitis as adults can fight off the infection on their own without taking any drugs. Okay, the body's immune system can go ahead to clear this virus within a period less than 6 months. And the person, when retested, in 6 month period or in a 1 year period, the person can now be negative. Okay, so and then a very few percent of those are infected as adults will go on to have chronic infection. Okay, and they are also okay. Then the reverse is the case if the infection is acquired at childhood. Okay, one of the modes, as I'll come to discuss, one of the modes of transmission of this virus is via blood is via mother to child transmission of the disease. Okay, so when a woman is pregnant and she has hepatitis infection and she gives birth during the perinatal period, that's the process of giving birth, she can pass on the infection to her child. And when that occurs, when the child acquires that infection from birth, the chance of the child having that virus chronically is very, very high. Okay, that is why, thanks to the Nigerian government, we now have the inclusion of vaccination for hepatitis B as part of the national immunization program. Okay, so the hepatitis B there's a vaccine for hepatitis B. So that vaccine has been incorporated into the Nigerian program for immunization. So children who are born, the very first day the child is born, is given the vaccine to prevent it. However, those who are unfortunate not to receive that vaccine and their mothers are hepatitis carriers, they can pass on that infection to their child. And when that occurs, the child is likely going to be a chronic carrier, and the virus will have a long period of time to cause damage to the liver of that child. And so when the child begins to, as an adult, the child may begin to experience these symptoms mentioned here. Okay, the person may begin to experience, someone that is having hepatitis can experience these symptoms, can have low-grade fever. Okay, so they can have jaundice or yellowing of the eyes. Okay, this is not quite as common as we think, but there are those that experience this jaundice. Their eyes okay, begin to turn yellowish. Okay, so when you experience such symptom, you may have viral hepatitis. There are other causes of jaundice, but viral infection with viral hepatitis is also one very, very important cause that we need to always be looking at. And then other symptoms they can have is weakness and fatigue. You are constantly tired, okay? Even you wake up in the morning, you haven't done anything much, you just feel tired. You don't want to even leave the bed, okay? So even though you've had enough sleep, you wake up, you're supposed to be refreshed, you just keep on feeling weak. It could be that you have viral hepatitis. It's one of the presentation. Most of these symptoms here, like I mentioned, they are non-specific. They are non-specific. So it's important for us as people, as individuals who care about our health, to go for screening. Okay, the counsel I want to give to us is that we should go and screen ourselves for viral hepatitis, especially hepatitis B and hepatitis C. It's quite very, very common within our country. As we can see, 20 million infection means that 10% of the Nigerian population is infected. Okay, having a population of about 200 million or above, 20 million people infected means we have about 10% rate of infection. So a lot of people are going about with this infection without knowing. So if you may not feel these symptoms, okay, but you try and go for screening, very, very important. So other people could experience symptoms like loss of appetite, okay, and then there could be passage of dark urine, okay, your urine is very concentrated, looking not necessarily concentrated, it's looking yellowish, okay, very yellowish. You need to, it's possible that you could have viral hepatitis. There are other clinical features that people that someone infected with viral hepatitis could have that are not listed here. This is just a brief summary of some of the symptoms that can be experienced, and most of them are non-specific. Other symptoms that can be attributed to viral hepatitis are symptoms seen when complications have begun to set in. Okay, so patients could have swollen abdomen. Okay, they could have pain. The abdominal pain they are having is mostly at the right upper part of their abdomen, the right upper quadrant, we call it, of their abdomen. That's where they have the pain. Okay, so and then uh, some of them, their abdomen begins to enlarge. Okay, that's when you are beginning to have some form of some liver failure. Okay, you are having decompensated liver disease, and the patient may begin to accumulate fluid within his abdomen. Okay, having what we call ascites, and then the patient might begin to, apart from abdominal swelling, the legs of the patient could begin to also swell. Some patients may begin to complain of uh, chest pain. The chest pain is what we actually refer in the medical world as epigastric pain. Okay, so some may begin to vomit, and they vomit. They can even have a vomiting of blood. They vomit blood, frank blood. Okay, and in such scenarios, it means the person is developing decompensated liver disease, which means that the viral hepatitis has already caused a lot of damage to the liver, and as such, the person is beginning to show signs of liver failure. Okay, so those are the other symptoms that uh, can present. Okay, so for lack of time, I'll just rush and go into the treatment. The treatment of viral hepatitis um, is is um, is a decision that has to be carefully made by a doctor. Okay, um, not all cases require drug treatment. That is very, very important to note. Not all cases of viral hepatitis are going to require drug treatment. Okay, if you remember when I started this presentation, I told you not all patients infected with hepatitis will end up being chronic carriers. Many, in fact, over 60% are going to clear up the virus within their from their system, because the immune system, especially when you acquire the infection as adults, the immune system will try to fight off the virus and clear it out of your system. Okay, so in such cases, it's not even you will not become a chronic carrier. But when you eventually become a chronic carrier, not all chronic carriers will also require treatment. Okay, so the chronic carriers, only 30% of chronically infected persons will require drugs. So it means that a greater percentage, that is about 70% of those who are chronically infected, will not require drug treatment. So, but how do we know those who will require drug treatment, and then we separate from those who will require drug treatment? That is a case for the doctor to decide. Okay, so when you find yourself, when you go for a screening and you are told that you are hepatitis positive, the first thing to do is to try and go see a doctor. Okay, so the doctor is going to recommend some tests for you to carry out. Okay, some of those tests might include you doing a liver function test to check the integrity of the liver, and then it may also require you to do ultrasound scan. Okay, to also that will also help to check the integrity of the liver and the extent of the disease, and then he will also ask you to do other tests like the combo test, and then the viral load. The viral load tells the doctor the amount of the disease that, the amount of the virus that is within your system. Okay, so if even those that are chronic carriers of hepatitis could do have some form of immune system activation that tries to fight off the virus. So some people are successful in suppressing the viral load of the infection, and so they may not require treatment. They will only require monitoring. So all people who are chronically infected with hepatitis will require monitoring. That is the third point here. Okay, so all chronically people will require monitoring. So after the viral load, one of the key things that helps to help the doctor to decide which class of patients will go for treatment and which do not need treatment is the viral load. So if the viral load is very high, the doctor will have to place you on treatment. Okay, there are several antiviral drugs that can be used to manage hepatitis. Okay, so and it's at the discretion of the doctor to choose the appropriate one that will suit individual patients. So the monitoring that we're talking about here is repeating some of those tests that gives an idea about the function of the liver. Okay, tests that shows that your liver is not largely affected by this infection. So in monitoring the patient, the doctor may ask you to come back in 6 months' time to repeat some tests. Okay, so you may have to repeat the liver function test after 6 months, okay, to see how your liver is doing. And then you may also have to do an ultrasound scan, okay, to see how the liver is also doing. And then he may also ask you to repeat the viral load. So one of the challenges that people used to have about viral hepatitis is the fact that the viral load test is quite expensive. Okay, the test for viral load can cost between 20 to 40,000 depending on where you are. Okay, so it's one of the drawbacks to people accessing care for viral hepatitis, the viral load test, and it's one of the key tests that the doctor will use to either decide placing you on treatment or not. So, but many people, once they go to see the doctor, once they find out they're hepatitis positive, and then they go to see the doctor, and then the doctor now tells them that they need to do a test, which is a viral load, and that test might cost them about 20 or 40,000, in between, and they begin to feel like it's charging them too much money, and then they end up not doing the test, and then that's how they are being lost to follow up. But if you really care about your health, and if you want to avoid the later on complications of viral hepatitis, which includes liver failure or liver cancer, then I will advise you to strongly take the advice of your doctor and do that viral load test. And you will need to be doing it, okay, after some period of time. Okay, you can if you are, well, it's best to do the screening. I'm sorry, the follow up 6 monthly. Okay, so that if there's any change in the situation of the infection, the doctor will act appropriately. Okay, so maybe you are not on drugs, and then after a repeat check, it was noticed that your viral load has now increased significantly. Before, your immune system was able to contain the viral load, so the viral load is low. But after a while, maybe due to some factors, the viral load now increases. The doctor may now decide to put you on treatment. Okay, even though ab initio you were not on treatment. So this is why follow-up is very, very important. You need to be on follow-up for monitoring. Okay, so cases of hepatitis C infection that requires treatment, the good news for that is that it can be cured in 95% of cases. But then the issue of cost is also an issue, especially here in Nigeria, where we know the economic situation of the country is a bit hard. But the drugs are available. Okay, but hepatitis C, drugs for treatment of hepatitis C are available in large pharmacies around, but they are a bit costly. Okay, the cost of hepatitis C treatment where I am, I'm somewhere in the north. I'm actually in Katsina State. Around here, the cost of treatment for hepatitis C is between 120,000 to 200,000. Hello?
Okay, so the cost, all
right, then the cost of hepatitis C treatment can go as high as from 120,000 to 200 to above 200,000. Okay, depending on where you access the drugs. Okay, so the drug you may need to take over a period of 3 months or over a period of 6 months. Okay, hepatitis C is not it's not so much of a big burden in Nigeria as is hepatitis B. Okay, but it's still a challenge. Okay, and a good number of people are infected with it. So if you are infected with hepatitis C, you should know the good news is there's a drug treatment for it, and the drug treatment in 95% of cases can lead to cure of total cure from the virus. So that's the good news about hepatitis C. So for hepatitis B, however, does not have a cure. Most times, people that are chronically infected with hepatitis B will need a lifelong follow-up. Okay, so I've heard of situations where some people come and then they tell you that I was found to be hepatitis B positive, and then I went and took some herbal drugs, and then after a while I now repeated the test, and then I found out that I'm negative. It means the herbal stuff works. Okay, well, I don't know. Maybe it could be a miracle. Okay, miracles happen, but in most cases, okay, medically, people that are chronically infected with hepatitis B, okay, let's say you had the first test for hepatitis B done today, and then in 6 months' time, that same test was repeated, and you are still positive for hepatitis B. It just means that you're a chronic carrier. Okay, so if you now go ahead to do other tests like the viral load, and then the viral load is noticed to be high, you're going to be placed on drug, and that drug treatment is going to be for a lifetime. In most cases, it's going to be for a lifetime. Okay, so the good news for hepatitis B is that there's drug treatment. This drug treatment helps to prevent the complications of the disease that could happen later on in life. So some of the complications that will happen are the ones that I've mentioned. You could have liver failure, or you could have hepatic cancer. Okay, so hepatic cancer particularly is a very dreaded complication because it is a cancer that kills within 3 to 6 months once it is confirmed. Okay, so you do not want to take that chance. It is better for you to be on the drug treatment. Okay, a lot of in my short period of practice, I've seen a lot of lives, being lost to hepatitis C. I've seen a youth couple, someone who just took 5 months, an engineer took five years, to study in the university, and then when he was serving the country, he came in as a patient, and his liver was already gone, destroyed by hepatitis B. Okay, and if only he had known earlier, he had done a screening for hepatitis B, and he had begun to take drugs, the virus wouldn't have had the chance to multiply and keep on and then cause the complication which he now had, which was liver cancer. And within a period of 2 weeks, unfortunately, we lost that patient. Okay, the patient died. Okay, so his family really cried bitterly because they knew how difficult it was, having to spend so much money to train him in school, and then only for when it was about time for him to reap the harvest of his labor, we now lost him to hepatitis B. So please, I'm urging you to please take hepatitis B serious. Try and do the screening and try and make sure that you take the treatment if it's required. Okay, so for lack of time, I'll just rush into the prevention. Oh, I would have loved to spend much more time here. So for prevention of hepatitis, these are the things that can be done. Number one, top on the list is the use of vaccines. So remember I told you hepatitis B does not have a cure if you become a chronic carrier. However, it has a vaccine which can prevent the disease in over 90% of cases. Okay, so even though it does not have a cure, it can stop you from even having the disease in the first place. So that's the good thing about hepatitis B. There's a vaccine for it, and that vaccination, the vaccine program of Nigeria, which mostly is given to children, okay, has hepatitis B as a component. Okay, so most children born from, let's say, year 2012, I think the vaccination for hepatitis B was incorporated into the Nigerian program for immunization. That's the NPI schedule from year 2012. So most people born before 2012 wouldn't have received the vaccine, except for you to make your own conscientious effort to get the vaccine as an adult. But children born from 2012, okay, if they are born within the urban setting and are able to access proper care, will have received the vaccine at birth, and then after 6 weeks, 10 weeks, and then after 14 weeks. So that vaccine is protective. The vaccine for hepatitis B is usually given 3 times. Okay, 3 doses of the vaccine is usually administered. The first one you will receive. You receive the first dose. Then after a month, after a period of about 4 weeks, you get the next dose. Then after another 4 weeks, or after 3 months, depending on the schedule of the vaccinators, anywhere between 1 to 3 months, the second and the third dose can be given. Okay, so once you have received the 3 doses of the vaccine, you are protected for life. Okay, so that's the good thing about hepatitis B. There's a vaccine for it, and the vaccine is quite very, very effective. And then to prevent this disease also, safe sex practices is very, very important. Hepatitis B can be transferred from person to person through sexual intercourse. Okay, so once people have unprotected sex, if someone has unprotected sex with a person that is infected with hepatitis B, he or she can acquire the virus. Okay, from unsafe sex practices. It has been found that hepatitis B infection, just like HIV, has a high prevalence rate among homosexuals. Okay, so homosexuals also are seen to have high prevalence rate of hepatitis B. Okay, so another way to prevent the disease is by sterilizing medical equipment. Hepatitis B has been seen to be largely common among medical personnel. Okay, because and the reason is not far-fetched. People that work in the hospital, most times they have contact with blood and blood products. And then, as